Myofascial release techniques can be utilized using a foam roller. So for this foam rolling session, you'll actually need a foam roller. And let's begin. So the first part is to get down on all fours, place the foam roller on the floor, and just start rolling out your shins, the front of your shins. And you're just gonna roll forward and back, stay in a nice tucked position, just starting to massage out the front of those shins. These are an area that we typically don't think about, and we certainly don't massage. So it's an important area to address because it does connect into the foot. And if you have any foot issues, these are great muscles to make sure you massage out. All right, and once you've done both, you're gonna just isolate to one side, and you're going to do the exact same thing on one leg. Now, if you do happen to find an area of tension or tightness in the shin while you're doing this, hold that spot and just move your ankle around. Just see if you can kind of get that tenderness to dissipate or to dissolve. And typically we don't want to find anything more than a 5 out of 10 pain, so you'll decide how much pressure you're going to load on the leg. And once you find that appropriate pressure that gives you a 5 out of 10 discomfort, then you just kind of hold it out, roll it out, and then wait until it dissolves down to about a 2, and then you move on and find another spot. If you don't find anything, then you just roll right through. And basically athletes use foam rolling as a way to warm up as well. You'll notice after we roll out, you're going to feel a little bit warmer and certainly a lot looser. All right. So once you do the shin, we get into the quad. So in the quad, you're just going to get on top of that kneecap, and you're going to just roll out the top of the thigh. Here, you just want to make sure that that leg that you're rolling is very relaxed, that there's not any tension held in that leg. And notice how I'm shifting to the side of that leg to get to the IT band, and I'm traveling the entire distance of my leg. I'm not just staying in the belly of the muscle. I'm getting right to where the muscle inserts and right into where the muscle originates on the hip. And as you do that, you can start rolling around more and more to the side of that body and just looking and exploring for areas of tension. And again, like I said, on the shins, if you find an area that seems tight, you can just stay there and hold it. And then the other thing that you can do is, like I said, with the ankle, you can move the foot. Well, here, you can actually move the leg. And this you have to do very slowly and carefully, because that moving while pressure is being applied can actually cause a little bit more discomfort. Okay, so you just gotta be nice and gentle with that. And then once you've done a few moves, roll it out again and see if that maybe loosens it up. And then naturally you would go to your other side. On to the next section, making sure that you're rolling it all out, trying to find any tension through there. And then if you don't find any, move on into the quad. And just rolling through that whole length of the quad. Right from insertion to origin, and rolling to the side on that IT band. All right. And then we can't forget about the calves. So the back of the lower leg. And here you're going to just lift your bum up off the floor, and you're going to roll out the calf muscle. Nice and easy. And if you happen to find an area of tension, just stay on it, like I said earlier. And this time, if you're not finding there's enough load, you can cross the other leg over top, and you can add some more load so you can get deeper into the calf. Because sometimes the top of the calf isn't so bad, but it's the deeper muscles that travel into the foot that tend to be overworked, probably because of flat feet. If you have an arch that basically collapses, a lot of the muscles that travel into the foot are going to be overworked, and you'll find that the deeper you go foam roll out the calf, you'll notice that you start to find some tender areas the deeper you go. And you don't have to come off your bum. Maybe that's sufficient weight and you can just work it just with your legs crossed. Okay. Actually, we'll go to the other side. Again, start by exploring. You don't need to cross initially. You can just go and check and see how it all feels. This is really your opportunity to become aware of where your body holds tension, because sometimes we have pain in one part of the body and we don't actually know where it's coming from, but until we start exploring our body and foam rolling or using a lacrosse ball in my other video, you'll start becoming aware of areas where, oh, I didn't even know I had tension there. And if you find an area or you want to get deeper, you just cross that leg over and you can lift your bum up, which naturally adds more weight to the pressure being applied. And again, that's all up to you. And if you find a spot, again, you're going to move that ankle joint and just see if you can help kind of dissolve that tender area. Okay. Then we move on to the bum and upper hamstring. So here you're going to sit on the foam roller and you're just going to roll back and forth on the top of the sit bones and underneath the sit bones. So the sit bones are the two bones that we sit on. And when you go towards the hamstring, towards the back of the leg, that's actually where the hamstring inserts. It's right on that part of the sit bone. So you want to check that out and see how that feels. And then as you go and travel onto the other side of the sit bone, now you're getting into the top of the sacrum and through the lower back, all the fascia that lives in through that area. And in fact, that area is the area which is most populated with fascia. So if you have pelvic floor dysfunction, this is an area that you really want to make sure you're working. Okay. And then once you've doubled it, you're going to single it out, just like we did with the legs. You're going to come through one side, and it's all about twisting your body around and just exploring the entire width of the muscle as well as the length. So rotating around is really important when you're doing any kind of foam rolling or lacrosse ball myofascial release techniques. And then transfer to your other side. And just go have a look and see if there's anything there. If you find something, just hold it, breathe through it, wait for it to dissolve. Okay. And then we move into the back. So here, when you're going into your lower back, I don't recommend you stay there for very long. I would recommend that you go up just a little bit higher, because usually the lower back isn't the area that's lacking extension. And extension is this movement, flexion is this movement. So we tend to live in flexion, which becomes quite problematic, and we start to lose our ability to extend our spine. So this is a check that I always like to do with my patients and myself to make sure that my spine and everyone that I help heal is also having extension that's not being limited. And if they're not able to touch their head and their bum down and their arms up here, then I'm starting to wonder what's happening through their shoulder, what's happening in their spine, what's happening in their neck, what areas are tight and what's actually limiting them. Most of the time, the reason why the shoulders can't settle down through here or the head can't go back is because of stiffness in the thoracic spine where all the ribs tie in. So if you're unable to touch the head down, you're going to prop it up with a yoga block so that you can get to a position where you're resting your whole body, okay? And the goal eventually is to be able to get down to the ground naturally. So while you're waiting here, you just take a few deep breaths in and out. And as you inhale, you really feel the belly expand and fill up with air. And then as you exhale, everything just recoils. As you exhale, you feel free to use this as an opportunity to engage your pelvic floor muscles. So as you inhale, your belly expands. And anytime you're extending your thoracic spine, it becomes a lot easier to do belly breathing. And then as you exhale, you're going to prevent the passing of gas, the flow of urine, and you're going to draw navel towards spine, just like you're putting on a really tight pair of jeans. And that's the true pelvic floor inner core recruitment that's required to gain back optimal pelvic floor function. But this should feel like a very comfortable position. If it's not, then it's something you definitely want to spend time working on to get the extension that you once had. Your spine at one point in your life bent both ways, and if you've lost some of it, I would highly recommend you try to restore it. And so now when you're done testing that, you're going to continue to roll through the whole spine up into the neck region, between the shoulder blades, and you're going to continue to roll all the way out. When you get to your lower back, always kind of maintain a crunched position, sort of like you're doing a sit-up, and just keep that alive. I would not recommend you extend your spine while you're trying to address your lower back, because your lower back is the area that tends to have a lot of extension left in it, even once the thoracic extension has been lost. Okay, and so that's the back. And you can test different areas of your mid-back. It doesn't necessarily need to be at the lowest point. It can be up a little bit higher and see what kind of extension you have through that whole midsection of the back. All right, then we're gonna move into the big lat muscles. And most of us don't realize that the lats actually have myofascial or connective tissue insertion on the tailbone. And it comes all the way up. Here we call this thoracodorsal fascia. And then the muscle begins after all this fascial and ligamentous structures have adhered themselves or glued themselves onto the bones of the pelvis. And then all of a sudden you get this muscle that starts to form, and then it comes out into the front of the arm. And it's that muscle that allows us to do our pull-ups and is involved with internal rotation of the shoulder. This muscle, due to the nature of how we sit all day long, internal rotation and flexion, is going to be tight in most of us. So again, if you've got shoulder problems or any kind of issues with your gut or pelvic floor dysfunction, it's definitely a muscle that you don't want to overlook. So here, you're going to lie on your side. Now be very careful when you do this one because it's quite tender if it is in fact tight. So you're going to just roll on your arm, nice and easy, just looking to see if there's anything that's tight. And if you find something, you're just gonna wanna move the arm around, and I encourage you to help it. So active release is good, but passive release, so when you grab it and you pull it over, that also makes a difference as well. Okay, so sometimes the muscles just need to shut down so that you can do it passively. And then naturally you would do that on the same side, and I'll give you a view of the back. So here you're just rolling out through here, and you're just going to explore the whole length of that muscle. And once again, just moving the arm passively by grabbing it and pulling it over. And maybe you can't get over, maybe all you can get is this, and that's okay. Just try and move it as much as you can and see what kind of release you can get in those lats. And just like with the lacrosse ball, you can remove the shoe, and you can place your foot on that lacrosse or on the foam roller and just roll out the bottom of your foot. I do prefer using a lacrosse ball for this particular area, but if you have really sensitive feet, something like this might be a better start, and then you can progress to that lacrosse ball. All right, and then naturally you would do it on both feet. So that's your full body foam rolling release, and hopefully it brings you some relief in terms of any kind of soreness or tension that you're feeling through the body. Enjoy, have fun.